Pregnancy is a time of great change in the body, and while many of these changes are normal and healthy, some can silently affect both the mother and her baby without obvious warning signs. One of these is gestational diabetes, a condition many women have never heard of until they are diagnosed with it. Understanding how blood sugar works, why it matters during pregnancy, and how hormonal changes can interfere with insulin is essential for protecting maternal health and supporting healthy fetal development. By learning the basics of glucose metabolism, diabetes, and gestational diabetes, expectant mothers and their families can make informed decisions that reduce risks, improve outcomes, and ensure a safer pregnancy journey for both mother and child. Many people don't realize that a woman can feel completely healthy during pregnancy and still have a condition that can quietly affect both her health and her baby's future. Glucose is the most important source of energy for most tissues in the body, especially vital in the eyes, kidneys, nerves, heart, and brain. During pregnancy, hormonal changes from the placenta can interfere with how insulin works, creating a state known as gestational diabetes mellitus. This condition occurs in about 2 to 5% of pregnancies and often develops without obvious symptoms, which is why many women are unaware they have it. Screening is usually done between the 24th and 28th week of pregnancy, especially in women at higher risk, and the diagnostic criteria differ from those used for type 1 and type 2 diabetes. Gestational diabetes is not caused by excessive sugar intake alone, but by increased insulin resistance brought on by pregnancy-related hormonal changes. Management usually begins with dietary adjustments and healthy lifestyle habits, which are often enough to control blood glucose levels. When diet alone is not sufficient, insulin is the preferred and safest blood glucose-lowering treatment during pregnancy. In most cases, blood glucose levels return to normal after delivery, which can give a false sense of security. However, gestational diabetes is an important warning sign, as affected women have a 30 to 50% increased risk of developing type 2 diabetes later in life. Certain factors increase the risk of gestational diabetes, including being over 35 years of age, having a family history of diabetes, a history of gestational diabetes in a previous pregnancy, or complications in earlier pregnancies. If not properly managed, gestational diabetes can increase the risk of pregnancy and delivery complications for both mother and baby. The good news is that early screening, proper education, and good blood sugar control can significantly reduce these risks. Understanding how glucose, insulin, and pregnancy interact empowers women to protect their own health and give their babies the best possible start in life. Knowledge is the first step toward prevention and better outcomes. If you found this video helpful, please share it with someone who is pregnant or planning a pregnancy, and subscribe for more trusted health education. Don't forget to leave a comment or question below. I'd love to hear from you.